Imagine waking up in the Stone Age with a toothache. The sun is rising, but you barely notice. One side of your face throbs with a deep, pulsing pain. Every bite sends a sharp shock through your jaw. Every heartbeat seems to make it worse. Today, a toothache usually means a quick visit to the dentist. But for most of human history, there were no dentists, no x-rays, no antibiotics, and no anesthetics. A bad tooth wasn't just painful, it could threaten your survival. For our ancestors, teeth were essential tools. They helped process food, maintain strength, and support daily life. A damaged or infected tooth could make eating difficult, weaken the body, and leave someone vulnerable in a world where survival depended on constant effort. Surprisingly, ancient humans generally had healthier teeth than many people imagine. For most of prehistory, diets contained very little refined sugar. Serious tooth decay only became common around 10,000 years ago, when humans began farming and consuming more carbohydrates. When tooth pain appeared, the first response was often simple endurance. People avoided chewing on the painful side. They sought softer foods. They waited and hoped the pain would fade. Sometimes it did. Sometimes it became much worse. As swelling increased and sleep disappeared, the problem became dangerous. In a world filled with predators, harsh environments, and constant physical demands, chronic pain and exhaustion could be life-threatening. But ancient humans did not simply suffer. They experimented, they searched for solutions, and eventually, they became the world's first dentists. Archaeologists have discovered evidence that humans were treating dental problems at least 14,000 years ago. In Italy, researchers examined an ancient skull and found a decayed tooth that had been deliberately scraped with a sharp flint tool. Someone had attempted to remove the rotten material. This was not an accident. It was dental treatment. Thousands of years later, dental techniques became even more sophisticated. In what is now Pakistan, archaeologists discovered ancient molars containing tiny, precisely drilled holes. These holes were created between 9,000 and 7,500 years ago. The tool was likely a bow drill, a simple device made from wood, cord, and a sharp stone tip. By moving the bow back and forth, the drill rotated rapidly enough to bore into a tooth. Imagine sitting perfectly still while someone lowered a spinning stone drill into your mouth. There were no modern painkillers, no numbing injections, only determination and trust. Yet people willingly underwent these procedures because the alternative was often worse. Ancient dentists did not stop at drilling. They also created fillings. One of the oldest known examples was discovered in a 6,500-year-old human jaw from Italy. A damaged tooth had been filled with beeswax. It was an ingenious choice. When warmed, beeswax becomes soft and moldable. As it cools, it hardens into a protective seal. It also possesses natural antibacterial and anti-inflammatory properties. Thousands of years before modern dentistry, humans had already discovered the basic concept of cleaning a cavity and filling the hole. As civilizations developed, explanations for tooth pain became more imaginative. One of the most widespread beliefs was the legend of the tooth worm. According to this theory, tiny worms lived inside teeth and caused pain by burrowing through them. If the pain became intense, people believed the worm was moving. If the pain stopped, the worm was resting. The belief persisted for centuries and inspired countless remedies. One popular treatment involved coating an aching tooth with honey. The sweetness was supposed to lure the worm out so it could be removed. People spent entire nights waiting for a creature that never existed. When honey failed, healers turned to an astonishing collection of folk remedies. Some prescribed donkey's milk as a mouthwash. Others recommended mixtures containing spiders, eggshells, and oil. Certain traditions involved placing onions in the ear nearest the painful tooth. Frogs were also surprisingly popular. Depending on the region, sufferers might spit into a frog's mouth or place a live frog against their face. For teething infants, some folk remedies even suggested rubbing animal brain tissue onto the gums. Most of these treatments offered little real benefit, but they reveal something important. People were constantly searching for answers. Even when they misunderstood the cause, they refused to stop looking for relief. Eventually, when all other treatments failed, there was only one option left. The tooth had to come out. For much of history, tooth extraction was considered a last resort. The tools were crude, the risks were enormous. A broken tooth root, severe bleeding, or infection could make the situation even worse. Yet unbearable pain often left no alternative. One famous extraction tool was known as the pelican. Named for its resemblance to a bird's beak, it used a metal claw to grip the tooth and lever it from the jaw. Later came the tooth key. It resembled a large door key and worked in a similar way. After gripping the tooth, the operator twisted the handle, wrenching the tooth from its socket. The procedure was quick. It was also terrifying. The tooth key became notorious for the damage it caused to surrounding bone and tissue. Only in the 19th century did more precise extraction forceps begin replacing these brutal instruments. The foundations of modern dentistry were finally taking shape. Despite the primitive tools and limited knowledge, ancient people understood one thing very well. Pain could not always be ignored. A severe tooth infection could spread throughout the body. It could cause fever, swelling, weakness, and even death. Helping someone with a toothache was more than an act of compassion. It protected the entire community. A hunter unable to eat became less effective. A parent weakened by infection struggled to care for children. An elder suffering from constant pain could no longer contribute valuable knowledge. Dental care was survival care. When we look back at the history of toothaches, it is easy to focus on the strange remedies and frightening tools. But the real story is one of human resilience. Faced with pain they barely understood, our ancestors refused to surrender. They experimented, they adapted, they learned. And slowly, over thousands of years, they built the foundations of modern dental medicine. Somewhere in the distant past, a person looked at a suffering friend and decided that doing nothing was no longer enough. That decision changed history. The next time you sit comfortably in a dentist chair, remember the people who came before us. The individuals armed with little more than sharp stones, simple tools, and determination. They may not have had modern science, but they shared the same belief we do today. Problems can be solved. Pain can be treated. And sometimes, even the most terrifying challenge can be overcome.